Hello, everyone. Welcome back to another episode of Medicine in Minutes. I'm your host, Priyanka, and today we have with us Dr. Rafi M. Shaji, who is a 2025 Maths resident in internal medicine at Maimonides Health in Brooklyn, New York. Hello, Rafi.
Hi.
What's up?
I'm chilling. I'm in Bangalore for like a good 10 days.
How are you liking Bangalore?
It's home, I did med school here. Went to Rama, like all of you guys. Thanks for having me.
It's really nice to have you. Can you tell us a little bit about yourself, where you're from and where you did undergrad?
So I was born and raised in Dubai. I moved to India for my last 2 years of high school, following which I came to Rama for med school. So I graduated in 2023. And in short, like a form of synopsis, I had a great time. Bangalore is like my second home, I would say. And originally my parents are from Trivandrum, so I'm technically Keralite. But yeah, I spend more time in Bangalore than I have in Kerala. So Bangalore is home. I'm enjoying it.
That's lovely. And while you were in med school, what were some of the subjects or such specialities that you were inclined towards, and how did you end up landing on that?
So my first year itself, I noticed that I wasn't too keen on anatomy. I didn't have it in me. I felt like there was just too much happening in a certain way that I did not relate to. I really liked physiology. And in second year, I loved pathology and pharmac. Micro, not so much, but I had to like it at one point in time. I came to internal medicine because, for quick context, my dad's a physician too, who mainly practiced acute medicine. So growing up, he used to discuss cases with my sister when he used to come back from the hospital, and it involved a lot of analytics and detective work, rare syndromes, stuff like that. And I was like, you know what, this is something that I kind of see myself doing. And I guess that's pretty much it. I knew I just wasn't cut out for surgery, to be honest. So it was a good balance of me being interested in the subject and also process of elimination. But more interest, I would say. I think good 80% interest, 20%, I did not like anything else.
That's fair enough. That's good. And did you look at any other specialties, anything else that inclined you, and then were there any other factors that contributed to you just landing on IM? Like, I understand the whole you didn't incline towards surgery, but what about the other broader aspects?
Or the other specialties, you mean? I would say no. Yeah. I mean, that's the simplest answer I can give you. I'm just being honest here. Like, I knew quite early on that IM was meant for me. I'm meant for IM. Pediatrics is medicine for kids, but there's just this whole other dimension of pediatrics where you also have to deal with the parental side of things. And, they're also part of the patient. And I just didn't know if I was cut out for something like that. I just liked adult medicine and adult patients, I guess. So that was an easy choice to make.
Yeah. Is there something that you're looking at after residency, any fellowships?
Oh, yeah.
Anything you want to?
So 100%, if I'm doing a fellowship, which I am inclined to do, it'll be in oncology. Few reasons behind me going into oncology. So oncology, because things that were deemed incurable maybe 30, 40 years ago, drugs that are unheard of. I honestly don't have a clue about anything oncology related right now, which is why I'm hoping to get into internal medicine to learn more. But it's just such a rapidly evolving field, so cerebral. The prospect of making a positive impact in a patient's life, especially cancer patients' life, that's something that would give me immense gratification. And also, I feel like the job, I wouldn't say the job security. I would say the work-life balance that oncology offers among the other internal medicine specialties is also something that I quite look forward to. I would like to not be on call as much, stuff like that. And the pathology is complex, interesting. It's everything that I want in a specialty.
And when you were starting out, when you were in med school, why were you what got you to be inclined towards going to the US and practicing medicine there as compared to practicing medicine in India?
Well, I have a come from a family of doctors. My elder sister is one. My dad's one, partly trained in the UK, stuff like that. So I had a good idea of what it takes to practice medicine in India, like entering a good postgraduate program through my sister. Funny enough, it wasn't my idea to pursue the USMLE at all. It was during my second year And just before COVID began, I was quite close to a few of my seniors in college, and they were like, you know, you don't have third year because essentially online COVID happened, and they were like, you should probably make use of this opportunity, and why don't you try your hand at the steps, because they were 3 years senior to me and they were going to give their steps soon. So I was just like, okay, this seems interesting. They believed in. They were like, you look like you have the potential. Why not go for it? Initially, I always told myself the USMLEs were extremely hard. This is something out of my scope or bandwidth. And that's what I told myself in my first and second year. I remember distinctly. But this is actually how I got started. And once I started learning, I saw that there was more to the process that I wanted to be a part of. And here we are today, I guess.
Also, you mentioned that your friends around you really made a difference
Oh, yeah.
about with you pursuing this path, and
Yeah.
understanding how far you can go in medicine. So, how important it is, and how much should you weigh in the factor with like other people around you telling you what kind of paths that you can pursue? How much does company matter?
So again, these are all very subjective opinions, and since in my case, I would say even to people who are like trying to pursue any career path in medicine, I would say it's imperative that you have a good circle around you. Like I said, in my case, the initial decision of me even trying to pursue the steps is not even my own idea. I mean, I did put in the hard work for the exams, studying for all of them, going there, landing my rotations, doing well at them, applying. But from day one, from instilling the idea in my head to helping me throughout the process, helping me throughout the application process, which is another very important aspect of the USMLE journey. It's not as straightforward as getting your exams, finishing a few rotations, and you match. That's not how it works. Having a good support system throughout is essentially what got me here. And I would never I would say it's a good 60 to 40%, 60 to 70% of everything important that's happened to me during this journey, I would attribute to having the right support system. Obviously, your efforts do matter. The most important part is that, but I would say it makes a world of difference. There's so many aspects to getting the right recommendations, getting interviews at programs, just getting perspectives from people who've been through the process, which is very important. I would say I was just quite lucky to have all of that. And I would say that's what landed me in the position I am today.
And also, because the whole process of the application, the going into rotations and applying over there, it seems very daunting and like a very mentally exhausting task. So is there something else? Of course, the people around you help. Is there anything else that you thought helped you just, get through it and push through it?
So, I mean, this all, what you just asked kind of ties into having the right people around, because initially when you're faced with this prospect of going to another country, to different hospital systems, working with a completely different medical and healthcare system with different teams, it is easy to get quite intimidated, which is absolutely normal. What helped, alleviate a lot of that anxiety was just see people go through it themselves, getting their perspectives. Like I said, this all ties into knowing the right people. And it's much easier to approach people you know well. And obviously you have to do your own research about everything, but it's much different from just reading things you see online and trying to apply that into what you want to do. It's just easier getting real life perspectives from people who go through the journey. And the thing that teaches you the most about everything is actually going through it yourself. And you can plan ahead, I don't know, maybe months or years in advance for things that you want to do, but along the course of the journey, like let's say you're someone who's interested in this, you will see so many things that you encounter, so many things outside your purview that you really never factored in before. They're not really in your control. You cannot factor in every little variable. So the best way to learn about it, I would say the easiest 2 bullet points: have the right people around you who are experienced. Number 2, experience it yourself, make that jump, and that'll get you places.
And did you consider going to any other place other than the US, explore UK or Australia or any other country?
I did think about it in my first or second year. Like I said, when I had these conversations with my seniors, they were also considering these options. So I learned about it through them. So I did have some personal opinions along with their opinions. And I would say no. I definitely decided my second year, end of my second year, that this is definitely what I wanted. And the way I looked at it was, this is the only thing I'm doing, and it's either this or nothing. And for people choosing a career path, it's always good to weigh the options, the alternatives. I'm not saying this is the only thing that's worth pursuing in medicine. You can become a great physician, a great doctor, wherever you practice, India, UK, New Zealand, any country. It's just having your priorities in mind, what they are. Make that decision quite early. And the thing is, if you have this decision clear in your mind, you're going to give it your all, when you make that effort. Otherwise, if you are considering too many options, even towards the end of your med school, let's say, you have your foot in too many baskets, and you're never going to give your 100%. For me, I believe that's what helped me do a lot of the things that I did. And I've seen people around committed too many things, and it just doesn't make a lot of sense and doesn't end well in a lot of cases. That's what I have to say about that.
Let's just dive a little bit more into the USMLE, the exam as such. So could you tell us a little bit about your timeline when you gave it, how you gave it, the number of months of prep?
So, like I said, the idea to start the step prep was instilled into me by my seniors. So that was end of second year, beginning of third year. We had COVID, so most of our classes are online. I did not attend. I did not have to attend. Leave a laptop screen on. Do the bare minimum. So that's when I started using Boards and Beyond. So my senior gave me his Boards and Beyond subscription, which is what got me into it. And I was like, interesting. This is making me understand medicine like I haven't before. So throughout third year, it's not the whole of third year, but I would say good 5 to 6 months, I just dedicated to watching a few videos at a time every day. For context, I gave step 1 of my USMLE as a scored exam. So I studied for a score. I knew I wasn't studying just to pass. And throughout third year, I watched a little bit of Boards and Beyond. That was my primary resource to build my foundational concepts. Final year is when I started doing my UWorld. So following my third year externals, I think I took a month or two as a break just to chill, clear my mind, and I got right to it. It did help a bit that the first few months of final year was all right for us. So I just attended the clinics bit and not really attended theory classes. But second half of final year was very much in person, and that was quite hectic too. That's when I ramped up my prep, and my step 1 was a month before my final year externals. So I was really in a time crunch. So in short, BNB third year, few months of third year, UWorld in my final year. And some additional resources on the side, like I didn't use Sketchy, stuff like that, but these were my 2 primary resources to keep it simple.
And Boards and Beyond, you used it along with first aid, like from the very beginning, not like as a supplement to first aid.
Yeah, so how I did it was I'd watch the videos on Boards and Beyond, and I've been told by my seniors, do not annotate everything you see on Boards and Beyond into your first aid. That just takes up too much space. Reserve your annotation space on first aid for things you learn from UWorld. So I watched an entire system or a few videos, and then I read the bit in first aid for that system or that chapter. And how I approached Boards and Beyond was I'd learn a system, like not a subject. So I wouldn't go into it as physiology, pathology, pharmac. I would learn it as cardiology, gastro, renal, because you need to learn all of these subsystems when you approach a certain topic. You shouldn't divide and learn is what I think when it comes to your steps. Develop an integrative method of thinking. That's what really helps you for these exams. So yeah, that's how I use Boards and Beyond. And finally, just purely your work and learn from it.
And also, like a lot of people, me included, we feel like we don't have a lot of our basics right, even after being in, going through 2 years of med school. So is there something that you think would help if, what are some of the things you did to strengthen some of the basics that you need to know to build a foundation of your step 1?
To be very honest, when I started my step prep, when I started watching boards, just the first building block, like you said, I exactly felt the same. I was like, what did I do for the last 2 years of med school? And I did quite well in college. And I think it just ties down to how we study for the exams in college. The theory exams, and they're not as application based as the steps. And you can study for an external in maybe 1 week, go through the last 5 years previous question papers, pass the exam like that, which was what most of us was trying to do. And that's not how learning should be. But unfortunately, like circumstances and time crunches, how the exam is. So what I would say would help, change that is maybe implementing a lot of these resources earlier in your study schedule during college itself. Let's say you're in second year learning pathology, pharmacology, micro. Watch the videos for pathology. Pathoma is an excellent resource, by the way. So for the step one, the first 3 chapters of pathoma is like gold standard. You need to know it in and out. I've heard a lot of people use pathoma quite early on. So supplement whatever you're learning in college with the resources for the steps like pathoma, BNB. I would say it'll just help solidify the foundation a little more. I didn't do it, which is why I'm telling you and anyone taking up his journey to do it. I would say that's just one way you could approach it. It's just our systems of learning and our curriculum is quite different. So you need these external resources, but the only thing is start early, especially if you know this is what you want to do. And not even let's say you can use pathoma and boards and beyond, even if you're not trying to pursue the US residency path, because these resources really help build your subject knowledge. So that's what I'd have to say.
Also, during your prep, did you feel like there were some things that, helped, some things that worked, or some things you realized were trial and error that just didn't work out for you, just from personal experience?
So for me, I felt like, especially when you watch videos for the different systems, when they're explaining topics in pathology, physiology, these are a little more easy to gauge than, let's say, topics like microbiology, immunology, genetics. And I was quite weak at biochem, stuff like that. So at one point where I finished watching most of the videos for my organ systems, I felt like watching the videos for biochem and immunology, all of that didn't really work for me. I felt like I needed more with these. I needed to approach it from an exact point of view, because at the end of the day, you can keep learning for 3 years, but you have to take your exam at some point of time. And I was on a time crunch, like I mentioned earlier. So for these topics, biochem, immunology, I mainly learned from UWorld because the explanations on UWorld are excellent. So I just jumped into it, attempt the questions, do horribly on a block, but it's cool. UWorld's a learning tool. Learn from the explanations and use your first aid along with it. There's some resources like Sketchy, which helps a lot of people. Personally, I just didn't feel like I had the time for Sketchy, because in Sketchy, each organism is a video. I didn't feel like I had the time to watch one video per organism because there's, I don't know, 6 or 7 of them. But if it helps you, try it out. Absolutely go that route. But for me, for these, I just, things that I found hard to understand, directly dive into the questions, learn from them. Teaches you a lot more than if you would just learn from a video, passively listening.
Listening, trial and error.
Yeah.
See what works for you.
Yeah, because I've realized that I was not learning anything watching the videos. You kind of zone out after a certain point. It's like how you are in college.
Yeah.
You're not paying attention the whole 6 or 7 hours you're in college. Imagine something that's not registering. So you need to apply it and see if you're learning that way. And for me, that really worked. And a lot of people adopt this approach too. So
Yeah, because it's very hard to just passively put it in. It's better to try to put it into practice and see if you've got it or
Exactly.
not. And you mentioned you were a COVID batch. So what was it like attending clinics and stuff that is usually a lot more hands-on in such a setting?
Well, so our third year, so our main subjects, I mean, it's quite different from the curriculum we have now, was DND, OFTHAL, and COMET. Our clinical teaching was online. Yeah, you do lose out on valuable presentations, in any of these subjects. Whatever you see in the hospital teaches you more than you could read in a book. But like I said earlier about factors that you cannot really account for, there was nothing that could have prepared us for this. No one saw us going through a global pandemic. All you can do from your end would be just, especially me, because I was doing my step prep, I just gave it my all in that, kind of diverted my energy into that. I didn't really think of it as oh my God, like COVID happened. I missed out on a whole year of in-person learning. I'm going to become a terrible doctor. No, yeah, that's not how I looked at it. I did what I could, the comfort of my home. Once I got back into college, you do what you have to do there. Whatever, I looked at it as the next time I come into a hospital, I know what I can apply from my foundational concepts that I've been learning for the steps. So I looked at it that way. So I made the most out of the cards that I've been given.
We couldn't, none of us could have
Yeah.
in that comment. Also, tell us a little bit about your rotations. How did you go about them, applying for them?
Okay.
And which ones did you land on and how?
So I did 3 months, and I did all of my rotations after I graduated. So one clinical externship and two observerships. There's a lot of misconceptions about the different types of rotations you have out there. Just as a preface, you do not only have to do electives because they're quite hard to learn, as you might know. So luckily for me, just to be completely honest, I did not have to worry about the whole application bit for my rotations because my dad's a physician, quite senior too. So a lot of his doctor friends from back in the day are in the US, and he had multiple people who he could just approach and ask on my behalf. But the thing is, right after COVID, a lot of hospitals changed their policies with accepting students. If he asked 10 people, maybe 7 said that they couldn't take me in because of COVID policy changes, but I landed up at 3 places. I did 1 month of cardiology at Case Western Reserve University, University Hospitals of Cleveland, 1 month at Maimonides Medical Center, which is where I matched. And I felt like that played a huge role in me matching there. And one was at an outpatient practice in Indiana. So in my case, all of my rotations were through contacts. I did not have to go through a formal application process, but I do know quite a bit about it because I've seen people around and go through the same.
So it also, when we're applying for rotations, it's a lot better to try to get a rotation in a place where you potentially want to land.
Yeah.
You want to match into.
Yeah, so this is something I stand by, and I can vouch for it personally because I did it, I lived it. So I see like there's this current trend where a lot of students apply for these electives, and they're quite competitive. As in, a lot of India is not the only country where if angels from all over the world applying to these big name institutions. There are a lot of hospitals that are known for giving hands-on electives, like I think FIU, UAB. Then obviously the big names like Cornell, Duke, whatever. If they give electives, people choose to apply into these. I do not agree with this herd mentality. I strongly believe that getting a letter from a big name is not the most important bit. It's rather what's in the letter, what's being said about you. Absolutely, if given the opportunity, go for a rotation at a place that has a residency program in the specialty you want to apply into. This could be an observership or an elective, whatever it is. Mainly, these are the 2 main categories that IMGs have access to. Let's say you don't get an elective, absolutely just look for an observership at least, because at the end of the day, what matters is you showing up, letting them know that you're there, you're working hard, you want to improve. These things you can do as part of an observership too. The elective obviously gives you access to the EMR, stuff like that. And yes, it is valued a little more, but an elective at a place that you really don't stand a chance of getting an interview is not going to mean much if you're just there for a brand name letter. Because at the end of the day, all you need is that one interview to go well for you. Personally speaking, I know a very close friend of mine who matched with a single interview, and I know someone who didn't match with double-digit interviews, 9 interviews, almost double-digit. And all you need is to make that impression at that one place. And absolutely give it your all over there. Almost, I wouldn't say guarantees you an interview, but if you interview at that program, you have something to talk about on the interview, which was a huge deal in my own interview. So speaking of experience, I can vouch for that.
And what about letters of recommendation? How important are they? Just like in brief, why is it so important to get a good quality letter, not a big name letter?
So the differences come, there are multiple factors that come into this. So like I said, try to ideally get a rotation in a hospital with a residency program. And for a lot of these hospitals, you might have to do a little deep dive on your own, find those hospitals. They're not really popular or out there. The top 20 rotations, if you do a Google search, a lot of websites will tell you, oh, these hospitals offer electives. You need to realize that a lot of IMGs apply to these same hospitals. So when it comes to these rotations, you have maybe 5 to 10 people in different departments rotating all throughout the year, every month. So let's say you rotated gastro at a really popular place that offers electives. The next few months, the same attending is going to have at least 2 or 3 people every month for the rest of the year. So I believe that in order to get a really good letter, it's important to build a really personal relationship with your attending. I'm not saying you don't get that at popular places, but the odds of other people being there with you at the same time, multiple people coming every month, much higher at these popular places. The thing is, it's not about proving that you're the smartest person in the room. When I went for my rotations, I always felt the most stupid, especially during my cardiology rotation. It was just things I've never seen before. I was rotating with the cardiology fellows and the cardiology attendings who have like 40 years of experience under their belt. I'm never going to impress them with my knowledge, but it was rather the personal connection that I built with them, showing them my efforts, how much I was willing to learn and apply. So getting a good letter, the letter will more or less always talk about these personal qualities about you rather than how smart you are. Because you're not going to impress attendings with 40, 50 years of experience or even 10, 12 years of experience with your knowledge. We're all learning. Even at my stage, we're going to be learning for the foreseeable future. So a good letter should talk about how well you work with the team, how well you function in an environment that's new to you, things of that nature, how good you're communicating, how good you are at communicating with patients, because that is something that they look at. If, let's say, I've had the opportunity to interact with a lot of patients during my rotation, and some of them have approached my attendings and actually told them he was so great to talk to. And, he was just such a nice, calming energy. So it's things like that that will go on your letter and mean a lot. So these things you work for, and you cannot really predict how these things are going to go for you. No letter is guaranteed. Again, other factors like how busy your attending is, if they remember you by the time you ask for a letter. But all you can do is give it your best shot and focus on these things more rather than being the smartest in the room. That's one word of advice that I have to say.
And when you're going for these rotations, what kind of prep can you potentially do? Right? Because it's not just a different hospital, it's a different country. Mm-hmm. So what kind of prep do you think helps when you go for these clinical rotations?
So let's say you land a rotation in a certain subspecialty, let's say cardiology, gastro, stuff like that. What you can do at your level is maybe quickly brush up your understanding of basic cardiology, things that you learn in med school or through boards and beyond, or your step resources. Have all of that down pat, because you need something to be able to partake in a discussion regarding a plan of management. Especially in subspecialty rotations, when you're rounding with a team of fellows and attendings, you'll see that how they present cases, it's all to the point, really quick. You might not be used to that when you go. So learn about the SOAP format, SOAP, of case presentations when you go. It's different from how we present cases here. Obviously, they don't have the time to listen to every insignificant detail about your family history. It has to be straight and to the point. Basic cardiology obviously would be a must. I'm just using cardiology as an example because I did it. And what I believe helped me the most to be a little more involved in my clinical rotations, even my internal medicine ones, because in internal medicine, you see a broad range of pathology. Everything under the sun comes into your office. What I felt like really helped me was being done with my step 2 when I went. So for anyone watching this and anyone planning to go down this journey, I would say minimum have your step 1 done. Like I said, you never know when you're going to land a certain rotation, especially if you're doing an elective, which you have to be in medical school for. Or you could plan for it in such a way. You do certain rotations after you finish your step 2 as well. Because step 2 teaches you a lot about management, next best steps in investigation, things that you actually use in a clinical setting. what test would you like to do? What clinical signs in these patients are you able to appreciate? So in my case, I would say absolutely step two helped me be involved a lot more than I would have if I just went fresh out of step one.
And like you mentioned, how important are connections? You said a lot of things happen through connections, and it's a lot of people just say that, oh, you have to network when you're in med school, you have to know people, but it's not just a matter of knowing people. You can't just go and ask someone for a favor. So it's how do you build that? And I know that's not something you can teach,
Yeah.
but how do you go about it?
So my personal experience, these connections came to me organically purely by virtue of me being close to certain people in my college. So I was never someone who shied away from making friends who were older than me. So a lot of the seniors that I met in college, I met through sports or some other, then could be like a random birthday party, but that's where it all began. And a lot of these connections form organically because one thing that, like you mentioned, how do you build these connections? It's not something you can do in a day, right? Building a connection is not you sending a random request to someone on Instagram or LinkedIn, being like, hey, can you help me out? You'd never know how busy they are. They don't know you that well. They maybe have 5 other people that they know better that they're going to help out. So a lot of these connections ideally should be built organically, but that is not possible or feasible in most cases, depending on circumstances. I was just blessed with the group of people that I had in college. I landed maybe 3 interviews at really good programs during my interview season, purely by virtue of how well they knew me. And it's not because I asked them for a favor as such, but they knew how I was as a person. And when someone recommends you for a residency interview, they're not recommending for you for your scores. They're not recommending the person on paper. They're recommending you for the person you are, because it's more than what you have on paper, right? So apart from that, you asked, how do you build these connections? So the connections that truly matter are the ones that you build when you go to the US. Let's say you go to a hospital with a residency program. You're going to be rounding with the residents or the fellows. Be nice, just see them as people outside of work too, because not everyone is about medicine at the end of the day. Have normal conversations with them about everyday things. They'll see that you're amiable, and that's the most important thing that you have to be in a rotation. Be amiable. Be open to talking to everyone around you. You are not in a position to just be all about work. So if you don't have these organic connections you develop in college, this is the next thing that you should ideally look forward to doing. Obviously, the cold emailing type of networking can work out in a lot of cases, but like I said, it's probably not the best approach because they don't know you in person that well, especially during interview season. You cannot just email someone at a program that you met or heard about through someone and be like, hey, I'm applying this year. You could be as formal as you can. Could you get me an interview at your program? A lot of the time, residents can only recommend 1 to 2 people, and they're going to reserve these recommendations of people that they know well, personally, at a personal level. So, which is why I said it's important that you do your rotations at hospitals that have residency programs, because the people who are in their first year of residency, when you rotate with them, by the time you apply, they're going to be in their 3rd year, by 2nd year, 3rd year, sometimes even a chief resident. And if you stay close to them throughout, make an effort to reach out to them throughout the time that, from the time you met them, it's going to mean a lot more. Their recommendation is going to be more personal and not just, hey, this person's applying, consider their application. I know this for a fact because I read some of the recommendations that I received from programs, and they were extremely personal. And they barely mentioned my scores, which were quite good. Nothing like that. So if you haven't started out, start in college. Start at your home ground and then work your way up to the US.
Also, when you were writing, this is just a little bit about the application process. I can ask you how many drafts you had for your personal statement and how daunting it is to write.
At least 10, I don't know, because every day you're introducing some change or the other. So if you count each of them as a draft, 3 changes a day into 30, I don't know, 20 at least, I don't know. But again, the inputs from people who've been through the process are the most valuable. In your personal statement, you are going to express why you want to go into that certain specialty. And you want to have something a little more personal. The thing about personal statements that I have to say, again, this is a very personal opinion. For internal medicine programs, there's like 10,000, 11,000 spots across the country. You have like over 20,000 people applying every year, 14,000 IMGs. Each program gets an average of 4,000 to 5,000 applications. This is the average statistic that's out there. Some programs get upwards of 7,000 to 9,000 to 10,000 applications. It is impossible to have 9,000 spectacular personal statements. Your personal statement should convey who you are as a person, why you want to go into that specialty. If you have a nice life story or experience tied into that specialty, mention it. But I would not say that it has to be an extraordinary personal statement in order for you to match. All a personal statement should do is to support your application and make sure there's nothing in there that can harm your application. Like I said, even if they narrow down 7,000 applications per program to 2,000 after the initial screening in, it is impossible to have 2,000 extraordinary personal statements. So you shouldn't be too stressed. Convey who you are, be real, be original. Do not have anything on there that can harm you. Don't say things like, well, I applied to this specialty because I wasn't sure if I wanted this or another specialty. No, this happens. This happens way more than you think. There are really, can I say stupid? Stupid things in certain personal statements. And I had I had a stupid sentence in my personal statement, the opening paragraph, which in my head, it was trying to convey a certain point. And when I got it proofread by my senior and people who were residents, they were like, we know what you're trying to say, but when the program directors are reading like 50 to 100 personal statements every day, it can't come across a certain way. Bottom line is, no negative connotations in your personal statement. Keep the vibe positive. You do not have to have a sob story.
Yeah, and everyone, like a lot of people around us have a lot of like very strong reasons to get into medicine, which is great.
Yeah.
Okay, which is awesome. If you have it, it's really good. But some people just come out of interest for the subject, for the science in itself. So we don't really have a story when it comes to a personal statement.
Yeah.
So is that something that people should be worried about? Or it's fine. You can just
Because
put what you have out there.
the thing is, the people who review residency applications, most of the time have been doing it for quite a while. Unless it's a brand new program director, even in that case, they're experienced attendings. People who review your applications, usually the program directors and associate program directors, you call them. Every program will have multiple associate PDs and one PD. They know when something doesn't feel real. And this will come into picture even more when you're interviewing with these people. So interestingly, because you mentioned impactful stories, there's an experience on your ERAS application called an impactful experience. So apart from the 10 experiences that you can list out, you only have a limit of 10. There's something called an impactful experience, which you can describe. I generally sat down and thought to myself, do I have anything to put on here? And this is a conversation that I've had with multiple people who've applied before me too. And we came to the conclusion that we don't need to conjure up something. We don't need to have it because it does say this, you can skip this if you don't have anything. If there's something so significant in your life that really impacted you going through this path, mention it 100%. But absolutely not something you have to be worried about. Like you said, for a lot of people, it's purely a pursuit of academic excellence, academic interests. For a lot of people, it could just be a job. Yeah. And all of these are okay. There's no right or wrong when it comes to personal experiences. These are all subjective. Only thing you have to be careful about is to not give away this impression that you're trying to be someone you're not. Portray this. It's okay to not come from struggle. I was quite privileged growing up. Pretty sure you are too. A lot of people that we see in our college, in and around you, do come from privileged backgrounds. It's absolutely okay to accept the privilege and not try to build a sob story. So do not worry about building or going through an impactful experience during.
If you can add stuff that you've seen through med school.
Yeah, that's what I did. So I left the impactful experience section blank because there was genuinely nothing in my own life that happened of such great significance. But in my personal statement, I did mentioned something about, growing up in Dubai to coming to India to do med school. And in India, during the community medicine postings, you will be posted in
Rural
a
area.
rural area. That shows you a lot of things that I've never personally seen before. Maybe people, who have their hometowns in and around such areas would be used to seeing a certain way of life. For me, absolutely not. It was just brand new to me. And it was just, you know, gave me a different perspective on things. I've been to hospitals in Dubai because my dad worked there. I've seen how it is there. And then I've seen the hospital that we had to work in when we went for community medicine postings. And I was like, wow, for these people, this is normal. And this is what they expect. That's it. But this college we study in is in the middle of Bangalore, such a reputed college. See the kind of patients that come there, the kind of treatments they get versus the kind of treatments people in these rural areas get. It really puts things into perspective for you. So that is something that I mentioned. Like you said, an experience with medical school. So quite important to have those.
It's anything that works for you.
Mhm.
And who are the people you think were very significant in helping you in your personal statement?
So everyone who reviewed it, in short, I think I ran it by my sister too. Um, uh, she's she's my other sibling who's a doctor. So I was like, what do you think of this? Because in my personal statement, I did mention that one of my sources of inspiration for going into medicine was my dad, and he's probably one of the best physicians and clinicians that I've come across. I've sat in the OPDs with him on multiple days. I've gone to the hospital where he teaches other residents in Dubai, and I didn't know any medicine when I visited the hospital then. This was my first year. But just the way other people spoke of him, I was like, and the cases that I've heard him discuss with my sister, once I got a better understanding of medicine, in retrospect, I can look back at these experiences and go like, wow, this is what was actually happening. So I did put things like that in my personal statement. So obviously, even if he didn't directly help in my personal statement, one of the main themes was that all of my seniors who are currently residents there, who reviewed and a few attendings too, I would say mainly these people. If I were to name people, it would be like a pretty long list. I don't think you need to go into the details of that. But yeah, anyone who helped review my personal statement, to be honest, and anyone who indirectly, led to those experiences. So I would thank the patients too that I met during my various rotations in the US and um, where I did my rural postings or in my college. So indirectly everyone. Yeah.
And what are some of the points that you thought are very important to consider when you are applying for a program in the US? When we have talked before, you mentioned that it's very important to be realistic when you apply to these programs. It's very important to be realistic as an IMG.
Mhm.
So what are some of the things that you considered while applying for a program?
So prior to this year, when applying IMG, I mean, the standard for IMGs is they apply anywhere between 150 to 200 programs in their specialty. Given how many programs are in that specialty, I don't think there are that many programs in neurology or maybe psych. But basically, you apply to way more programs than a US graduate would do. Like I have mentioned before, being realistic and knowing what place is going to interview you. One very important thing that's been introduced is signaling. If you're not aware of it, for people who are watching are not aware of it, signaling is when you can indicate to a program that you would really like to interview there, but it's not going to guarantee you an interview. Signaling actually helps USMDs more because USMDs get an average of 20 to 30 interviews and they only apply to maybe 50 to 60 because it the school they come from matters. And if you're in the US, you graduated out of a med school in the US, you're already at the top of the list. So our competition is not then. As IMGs, we cast such a wide net because we want every interview that we can get. And like I mentioned earlier, every interview is precious to us. And especially now that interviews have gone virtual, I believe that's another contributing factor. People with 9 to 10 to 15 interviews have the luxury to attend all of these interviews in the comfort of their homes. earlier, so some of my cousins were attending, and some of the attendings that I know, when they applied, and we sent out 8 years ago, all of these interviews were in person. So imagine going state to state, county to county in the US attending these interviews. Signaling for IMGs, you have to be extremely smart with it. You need to know what programs you realistically stand a chance at. Now, this is very important because I've come across a lot of juniors and a lot of people who want to match at the top five or the IVs. It's as as much as it would be good to do so. I don't think it should be the end goal, because the end goal is landing up at a place that will help you transform into a competent, confident, and compassionate physician, knowledgeable, capable of dealing with whatever patients come your way. Your goal should be to end up at a program that will facilitate that goal. It should not be landing up at a top 20 university. It's quite simple. Just pull up the list of residents, see statistically how many IMGs are matched there. Or you can never know if they are a USIMG or non-US IMG, but usually for a lot of these programs, it shows which school they're from, and it'll show you names of US schools. So USMDs or TOs. Avoid signaling those places, ideally, unless you have such a strong connection or recommendation. And from personal experience, I know someone who's actually a research fellow at Mass General Brigham, one of the main Harvard hospitals, and he's doing a gastroenterology research fellowship. And he was telling me about how they all know that despite having such a strong recommendation from Harvard attendings, you're not going to interview there. Even if you do land an interview, when it comes time to rank you, just because you're from an international medical school, you drop way down on that list. So how you select what places to signal, be aware through your seniors or people that you meet as IMGs. There are really good IMG programs that you can match into. So as we were saying, how do we decide what programs to apply to, how to signal? Every year you have, when you make your residency application, call it ERAS, so you register there. It gives you access to something called Residency Explorer. So you can check by percentage what programs have IMGs, what colleges they're from. I really look at that too, and then make a realistic list. You don't want to apply to programs that are 99% US. Don't signal that, because you don't want to waste signals. And obviously through your seniors and people for matching at different programs, have a good idea of what it takes. A lot of programs require a competitive score. The average step to score right now is 249. So 250 is just an average score, statistically speaking. But there are a lot of programs for which 250 is good enough, but a lot of programs for which 250 is a low score. Having a general idea of things, just talking to people will give you these things. Because I mentioned scores because when they receive these many applications, they have to screen you in. From the initial set of screening, they do another sub-screening to interview that many people. I can just give my program as an example. We take 30 residents a year, which is quite big. And the last year's stats showed that about 9,500 people applied. Yeah, this year, 10,000 plus people applied. I know this because I know a chief resident at the program. So you can imagine how competitive it would be to get screened into such programs. So obviously have a good score, have a good idea of what programs expect what, and apply to, don't just aim at big university hospitals. Like I said, a lot of community hospitals and community university offers excellent training. Just basically be realistic and know by word of mouth. Oh yeah.
A lot rides on it.
Okay, so again, this is strictly personal. So obviously it's quite stressful, like you mentioned. And when I first submitted my application, initial 1 month, you don't hear much because they're reviewing applications still. For IMGs, it maybe starts coming in mid-October to late October or maybe November. And I wanted to know how to prepare because it's the biggest deal. It all comes down to that one day. So first thing I did was reach out to my seniors and I was like, okay, what do I do? There's usually a list of questions that goes around. Even on the main AAMC website, gives you a list of the most commonly asked questions. People usually prepare long answers to be bullet points, stuff like that. So one thing my senior told me was, okay, I understand why you want to prepare because you're entering this part of the process for the first time. You've finished the exams and stuff, which is quite hard, the hardest part, but you have another hardest part coming. And what he told me was it's good to just have a framework for certain scenario based answers. Because, I can give an example. There are some questions they can ask you, like, what was one incident during a clinical rotations or during a medical school, a patient encounter that really shaped you or impacted you, or what did you learn from an experience, or a time you made a mistake in a clinical setting in in your medical school, and what did you learn from it? So just have the scenario ready in your mind for these things. And what my senior told me was, Raf, like, it's okay. You do not need to sit down and study for this like it's an exam. Just be a more formal version of you, and you should be good. And at that point, I still didn't know what he meant, because I see a lot of people, they pay for these interview prep resources, stuff like that. And I had multiple people I was asking who were residents, and they were like, nope, absolutely not. Go through this list for all of these basic scenarios and situational ones. Have a framework, things that require an incident, because a lot of the times they'll ask you questions where you cannot be completely prepared for. Like, they interview a lot of people every day, every session. And some of these questions are straight, what do you call them? They just, I don't know, out of the blue. I was asked a question at the program I matched. Tell me something that's boring about yourself. Yeah. And I had to think about an answer on the spot, and I could tell he really liked my answer, and because he did say it. So it's just about being natural, and they can really tell when you're putting up a front and when you're too rehearsed, because they don't want people who are robotic. And I've heard this from multiple people during my rotations there, because when I used to ask residents and fellows for advice, like, what do I look forward to? What do I do? How do I build myself up to the interview stage and doing well on them? And all they had to say was this: if you're amiable, you should come across as amiable. Do not come across as overconfident. Do not come across as the smartest person in the room. Just be authentic, not talking, try to relate to them, have things to talk about that you can, that's not something you can plan for. Yeah. Having things in common with the interviewer. I got really lucky at a lot of my interviews with that, because I was a huge football guy. So stuff like that. And to be honest, after my first interview, I understood more of what my senior was telling me. You cannot really prepare for this like it's an exam. It is really a test of who you are. Just be the most authentic version of yourself, but formal. That's about it.
And just to go a little bit into the research and extracurricular aspects of
Okay.
that are required for USMLE, or rather that are good for USMLE. What kind of research did you do when you were in Africa?
So on your application for the USMLE on ERAS, you can list research that's already published. There's an option to list research that's in the process of publishing, and then there's also a submitted option. So you can just enter the title. You can say it's been submitted. For the things under review, you usually get a link saying this article is under review, but obviously publish is when you have access to the manuscript through a link. You have to enter these details. So in my application, I had a total of 3 entries. One was research that was published. I was the first author. It was a study on diabetic neuropathy. One was on the usage of steroids during the COVID pandemic. And one was about eosinophil counts and sepsis. So the thing about research is I clearly did not have a lot, but it's not the most important part of your application. About research, it's more about what you learned doing the project. Even if it's one project, it's about what you learned contributing to the project. I think I've mentioned this before to a few people who've asked me, you're not expected to do or partake in groundbreaking research as a medical student. You just need to show effort in research. I would say on that end, research-wise, my application wasn't the strongest, but then again, it's not as important in internal medicine. Again, I can speak maybe for internal medicine, pediatrics. Neurology is very, for example, neurology and any surgical specialty is quite heavy on research. But what matters is research that's done in the US more. And it's not about just pumping out numbers for your residency application. They can see how much you've contributed. If you're like one name among 15 or 12 people, it doesn't really mean much. Yeah. And about co-curriculars, that I was quite heavy on in college. I was really into sport. I captained my college football team. That was on my application as well. What I was one of the meaningful experiences in my application was me being the sports secretary and my uh, college football team leadership. Luckily, at different program, I think around 3 to 4 people were soccer fans, as they call it there, and we had a lot to talk about there. About the extracurriculars, what would be good? Whatever good is whatever you can talk about and actually relate with the interviewer. So a lot of interviewers like cooking, painting, basically have something going on for you that's not medicine and it should be. I cannot say what co-curriculars are good or not good because that's a very subjective thing. I just got lucky because my interviewers love football and there was a poster of Messi on my wall in my interview setup, and one of them supported a rival club. One of them really liked Messi, so we spoke about that. So it's hang painting in your back if you're into painting. There's a good chance they'll ask you about it. Stuff like that. You cannot be too prepared for it, but baseline, just have something going on for you in college.
It's just some like medicine shouldn't be your entire person.
Oh, 100%.
And it's not like you have to only study. You should have things,
Oh, yeah.
anything beside
Yeah.
just studying and having college. And
Yeah.
I mean, it's not just because you're pursuing USMLE, you
Yeah.
need to be like, you, of course, you have to be focused, but you don't have to be totally into only that. You need to have
Yeah.
stuff other than.
During your exams, that's when you notice that you have to sacrifice a lot of things for those few months before the exams because you need to be absolutely zeroed in on the goal, which is doing well on your exam because you don't get retakes. It's a one-shot exam, right? But apart once that's out of the way, you can really just divulge, venture out, try different things, build your application outside, get volunteering experiences, stuff like that, because you can list all of these on your application. But now there's a limit, but
Anything that interests you. And just to wrap it up, and what kind of advice, or what's the best advice you've received and you think that would be good to pass it on to people who would want to do USMLE or just in general?
okay, so I'm going to list this as bullet points. So I'm going to have to think about it category wise. So, okay, we'll start with the steps. Number one, it's not all about studying well for the exam, especially this is something I was told. It's not just about studying well for the exam, it's about being a good test taker as well. And you can only become a good test taker if you take the exam. So I learned a lot from my step one experience because I felt horrible after the exam. A lot of things that go wrong, overthinking at every little thing that you don't know. Me to realize that this is a beast of an exam. It's 7 hours long for step one with 1 hour of break. So 8 hour session in total. Step two is 8 hours long of pure exam and a 1 hour break. So that's a 9 hour session. So just building endurance, just knowing how to be calm and composed, how not to fret, how not to start having a panic attack at the smallest thing that you feel like you don't know, because that will just ruin the flow for the rest of your exam. So with regards to the exam, it's this. So I'm just going to categorize my tips because there's a lot to go into. With the next important part about regarding the process of the electives or the rotations, because I've seen people talk about this when I went for my rotations. My attendings have told me about students that they've had previously, months ago or some years ago, whatever. Just be willing to talk to anyone who's on your team. Because if it looks like you're only there to secure a letter or, you're just not saying the right thing, if you interject, if you interrupt people when they're talking because you know the answer, while someone's saying something, you have a doubt, that's actually a good question, but, it came at the wrong time. But a lot of these social cues, a lot of people lack. And this is something you learn with experience and you pick up talking to other people. So have a good idea of these things and know that it's not about being the smartest person in the room. We are always learning. But being amiable, being friendly, these are things that we should ideally possess by this point of time. Because it's very easy to be disliked by a group of people,
Especially ones you don't know.
Yeah, exactly. Especially people you don't know. So just be amiable, friendly, make an active effort. That's that's what I would say with regards to the rotations and whatever advice, yeah, do it at programs with hospitals or universities with residency programs that take a good percentage of IMGs. Be realistic about your targets with regards to that. When it comes to the whole application and interview and all of that just clubbed together, I would say always reach out to people who've done the process before you. And because it is the most integral part of the whole thing. Because if you think about it, you've invested so much time and effort into your rotations, studying for your exams. If you kind of rush through your application or you just say the wrong things here and there, list the experiences that don't sound genuine, get it proofread by multiple people. Just know that everyone finds it difficult when they do it, including me. Now I'm in a position to like hand out advice because I made it to the other side. And that's only because I had the right inputs and the right insights. And this is about the application and about matching into residency. And one final bit that ties into everything in general, uh, just don't be obsessed with the prospect of, okay, maybe this does tie into the USMLE pathway, but just don't be obsessed with the prospect of making it to the US just for the sake of making it to the US. In medicine, there's n number of specialties and anyone could be interested in anything. Your decision should also primarily be tailored to what specialty truly calls out to you. So as IMGs, let's say you are really passionate about orthopedics, you really want to be an orthopedic surgeon or a neurosurgeon. Excellent, good for you. But statistically speaking, it's near impossible to almost impossible in the US unless you're willing to, finish residency here, go do fellowships there, take from alternate routes, know all of these beforehand. Otherwise, just luckily in my case, and a lot of people apply to specialties in the US, they know that they want to go into that specialty. Your end goal is what matters the most, not where you end up. That's probably the most important piece of advice that I have for all prospective candidates who are going down this path. Do not be infatuated by the prospect of being at a brand name place. That's not the end goal. It shouldn't be. Your end goal should be to become a competent physician and become a better person by the end of your residency, by the end of your fellowship, as you go on. Like, so any well-established hospital or community hospital, whatever it is, with good faculty will help you achieve this goal. That should be the end goal. So, and I really believe it because I've had inputs from so many attendings who've trained at great community hospitals, been to like universities across. So whatever I'm telling you are not exactly just my beliefs, but a combination of everything that I've heard from different people. And now I believe them because, and I've had a lot of similar opinions too. I stressed on this point because a lot of people who go through this process, especially starting out, say, oh, I have to be at this, this is where I want to go to. That should not be the end goal. Because as an IMG, you're going into another system that is extremely competitive, but doable. Be realistic about your goals and expectations. Work hard, obviously. And yeah, I guess that's about it. Just chill. Don't lose yourself in the process. That's something I did not do. I'm quite good at chilling. Yeah, just have a good time throughout it all. It is going to be difficult, extremely difficult actually, like pursuing residency in any country, but it is doable. That's it.
Thank you, Dr. Rafi. And thank you for tuning in. We're going to go get pizza now. We'll see you in the next one.